of them, they lack in speech. They can't really socialize with people because of their communication skills. That's why the teachers are here. We are here to help them. Yes, of course, we need the society as well to join us and help us. Like, I hope you just wipe out the preconception that you guys are scared of special children and all. You just come in and help them to help them in communication skills and maybe like interacting with them. Patient, and yeah, they lack of communication skills, but we need to be patient, and somehow they too inspire us to practice more on this field and to be a better educator.
Facing difficulty when they want to interact with the others society, for example, it's the society, because the society don't really understand what their problem is and don't really understand what is the condition about. When they come to the center, we will teach them how to control or overcome what they should do when there is outside. For example, when they go outing, they should not running or go to somewhere else. There must be someone to accompany them. The best support should be is the parents. The parents should be the more support that get from the student, so that the student will have more comfortable and confident when they go outside. But besides that, the society also should give support to them and not what we call sometimes the society don't understand what it is. My experience again is teach the student how to be independent in the future, and then I become more understand about what is it about. And how to manage them or to control them.
E-L-I-C-H. Đi đầu. Đi đầu.
My name is Aisha binti Muhammad Nasir. I'm an occupational therapist and as a teacher also. Almost everyone with Down syndrome has speech delay, which is have problem. They are not mute, but they have difficulty in communication, like slurred speech, and then specific in sentence and words they want to use. We taught them sign language, like toilet, shishi, to point to things what they want. Parents, siblings, teachers. From that community first, and then they will go to outside community, more biggest community. So first must be small community first. So if they can overcome that challenge to communicate. Most of the Down syndrome have problems in behavior problems. So the way to handle them is difficult for every child. Some of the child we had used soft handling method. Their nose flat, almost flat, and then their toes, big toes and another toes gap. bigger gap. Their fingers small, headache, short, and then ear a little bit open. For children with small children, for example, from age baby to maybe 3 years old, we provide accessory first because they are floppy, high tone and floppy. So we exercise more on increased muscle tone. Babies because they have poor head control, and then when they come to age 4 and so on, more on cognitive communication, social behavior. So more on communication, cognitive and soft skill, like how to buy that. When they are adolescent, some of them have speech, although not all. So maybe they can ask. Most of them need caregiver to go with them.
CUAKG, chocolate. Hands up, round.
I'm Jasmine. I'm the principal here, and I joined this center last year. And basically we are looking at children from 3.5 right up to 39, the oldest we have today. So it's a wide range of program that we are looking at. If you would have seen that this center is more like one-stop center where they have academic, they have living skills, they have occupational therapy, they also have physiotherapy. One thing that we don't have is the speech therapy. Other than that, the learning is more functional, academic. So what we teach is whatever it is applicable for them when they leave the center, or even in their daily living life skill. It's like, this is what they will be applying. For instance, the time and money skills. These are very essential things that we have to know. So this will be part of the learning here. If you see in Malaysia, the awareness of special needs are still very limited. Although there's so many campaigns done on the awareness of special education, but people are still not willing to give the opportunity, especially for children with special needs. Because they do have their limitations, and in order to work with them, you have to understand them well. Because these kids, their limitation in terms of academic, in terms of understanding the whatever job scope that you give them, as well as to be able part of the society, is still lacking. They still need supervision, and most of it has to be a sheltered kind of workshop if they want to be out there with the very long process. It all varies. When you talk about an autistic child, it's different. But if you're talking about Down syndrome, the severity of Down syndrome is different. It's wide range. Some kids, it's just the features. They have this Down syndrome features, but the IQ level is there. But like some of the other kids, the IQ level is also low together with their fine motor skills as well. If you can see their fingers is all not strong enough. See most of the Down syndrome kids. If you're saying about the challenges, how they overcome these challenges is basically through training. And the best thing would be if they start as early as possible with early intervention program. So when they do that, it's a progression of learning takes place. So as they graduate from early intervention to supplementary, and then it comes with the young adults learning. And then of course the workshops and the later part, the rest of the bakery, for instance, comes later. But how do they face? It's a wide time. They need to go through a lot of training. Of course, it's still with supervision. If you say overcome, I wouldn't say they can just come out of it. There is still limitation, but with support, but with motivation, they are able to do it. But not 100%. Of course, they still need some kind of prompting, sometimes physically or even verbal prompting. We have two range of parents. One parent actually to come in. But we do have volunteers coming in. Yeah, we are grateful that some of the universities, they send us interns here to be volunteers. So they actually help out with the students as well. And of course, we have walk-in volunteers coming in as well on a regular basis to help out these kids here. One thing I learned very significant is they're very innocent. They're naive, they're innocent, and they actually show you what is really love is. They are the ones who are genuine in what they do. And when you talk about rigidness, especially autistic kids, when you give certain tasks to them, they complete it. That's the best part of being some of the special kids. They are better performers than normal kids out there because they listen to instructions. After